Hello and welcome to our GOLD participants from around the world. I'm Fiona Lang-Sharp, IBCLC Public Relations Manager and MC for GOLD Learning. Welcome as I'm sitting down with Maryn Leister Green. Welcome to our GOLD Midwifery Conference. I'm so excited to have you, Maryn.
Hi, thank you, Fiona. I'm really excited to be here.
So I'm most excited to hear what you have to talk about. And Maryn is going to be talking about this. Her presentation is titled Rethinking the Approach to Group B Strep, Protecting Future Generations from the Harm of Routine Care. Wow. Now, this sounds like a very big topic, Maryn.
Yes, it is a very big topic, and I'm going to try to simplify it in a way to fit into the time presented and just to give people a overview of how we might approach this differently and why.
Well, that sounds like it's going to be jam-packed with some interesting things, and I'm certainly looking forward to hearing more. But first of all, I would like you just to introduce yourself to our listening audience today and just tell them why this topic is so important to you.
Sure. So I'm a certified professional midwife. I live in Arizona, and we have 7 children. I was introduced to Group B strep as a topic of personal concern when I was pregnant with my 3rd baby. And I hadn't done research, even though I was a midwifery student. It just hadn't affected me yet. It hadn't affected anybody that we had cared for. So it was rather late in my 3rd pregnancy that this became an issue. I tested positive for Group B strep after 2 pregnancies of not being positive, and it really put some fear into me. And anybody that knows me knows that I don't like to feel fear, and if I do, then it's time to research, it's time to look within, it's time to look back on information that we've lost. And that is exactly what I found with Group B strep, that we are pretty much going into damage control mode when it comes to testing and treating women, and that there's so much more to look at, and there's so many more issues that can really enable the health of mom and baby.
Well, I couldn't agree with you more. And I think, as I was thinking through what I was going to ask you today, I wanted to touch on just a few things so we could just have a snippet, for our listening audience to hear about what you're going to be talking about. But that really brings me into a segue of, why do you think that this topic really hasn't been addressed well in the past?
Well, Group B strep in the history of birth is a newer disease. We're recognizing it in a way, of course, that we weren't able to recognize it. So we don't know exactly how long it's been around, but I think the topic itself is being addressed with fear. I think it's being addressed mainly with protocol. And because we aren't really improving outcomes, I think it's time to take the new research, which is very valuable, but also combine it with the wisdom of the past. So again, even though GBS isn't maybe the oldest thing on the books, the wisdom that goes along with taking care of a mom's health and how her overall health might influence her baby's health is not a new idea. It's just getting back to seeing pregnancy as this multi-layered event, not just this physical test-ridden event.
Well, it's interesting you talk about the aspects of fear, and routine protocols in place with the GBS because we do work so hard with our birthing moms to really take an approach to rid them of fear. But when you bring in something like this, you're absolutely right. It seems to start developing this fear all over again. So I'm really glad to hear you bring that up because I think it's something that really needs to be addressed when we're working with our families. So lastly, I just want to ask, what are you hoping that our delegates will learn from this presentation?
I hope that people listening will take away a feeling of power when it comes to not only this issue, but lots of these routine issues that come up during pregnancies. So whether a woman is listening who's pregnant or a midwife, to know that there's so much more to an issue. It isn't just a test. It isn't just test results. That we are whole people, and that really no matter what comes up in our pregnancies, there's so many ways to deal with it.
Well, that sounds like a fantastic approach to me because I much prefer looking at the bigger picture, but I know that when we start identifying or isolating things like this, sometimes we can just run away with, ignoring the other factors as well. So thank you so much, even for just mentioning that today. It's great hearing you talk about these things. And I know that this is a big topic, and so I'm really looking forward to delving in deeper with you once we get into our full presentation. But today, Maryn, we have run out of time, but thank you so much for sitting down and chatting with us.
Yeah, thank you. I'm really looking forward to presenting this and just getting feedback.
Excellent. Well, we're looking forward to hearing all of it. And of course, for all of you listening out there, don't forget to join us for the Gold Midwifery Online Conference for 2016. So thank you so much, Maryn. Thanks for being with us, everyone. And everyone have a great rest of your day. Bye-bye for now.